Hi, good day. My name is Casalangi Lumanta from BSN 11E. For today's video, I will be performing the parental medication. And the first thing to do in order for us to execute the assessment properly is to check the doctor's order on the patient chart. So the rationale for this is that the chart of the patient's chart is more reliable than the medication tickets. So today I will going to validate or check the doctor's order. So after checking the doctor's order, next thing to do is that perform or introduce yourself and verify the client's identity, and then explain to her or him how he can participate during this assessment. Rationale for explaining the procedure to the client is that you can both work on an easy way, and you can administer the medication properly. So I will be hi ma'am, good day. My name is Casalangi Lumanta, and I am your student nurse for today. So what's your name again, ma'am? Thank you so much. And anyway, ma'am, I would like to inform you that I will be administering or I will be injecting your medication into your body. Okay. Is there anything else, ma'am, or any clarification before we proceed on this assessment? No. All right, ma'am. So I'll go ahead now and administer this medication to you. Okay. Thank you. The third step on this administering a medication, don't forget to wash your hands thoroughly. So the rationale for this is that this will avoid the contamination or the spreading of the microorganism into the medication. Next is that arrange the medication card on a hypodermic tray with a corresponding drug. So the rationale for this is that organization and planning results in economy of time and effort and minimize confusion. So I will be, this is my hypodermic tray. I already already prepared my materials that I will be needing in administering this medication. First is the syringe. Let's pretend that this is a vial and a cotton for the sanitation of the surface of the. So after performing the hand hygiene and the arranging of the medication card to the hypodermic tray with the corresponding drug, next thing to do is that choose an injection site with free effusions and discolorations. Select the side 3 to 4 finger widths below the antecubital space and one hand above the wrist. Rationale for this is that actually the forearm is convenient and easy location for introducing an agent intradermally. So after choosing the injection site, next thing to do is that position the client, position the patient's arm so that his elbow and his forearm are supported in a flat surface. Good day, ma'am. Again, my name is Casalangi Lumanta, and I will be performing the administration of medication. So first, ma'am, can you try to put your elbow or your arm to this flat surface? after positioning the patient's arm into a flat surface, next thing to do is that apply a clean gloves. Use an antiseptic swab to clean the site, beginning at the center in a circular motion outward about 2 inches or 5 centimeters. So the rationale for this is why we needed to wear a clean glove and why we needed to use an antiseptic swab is that we needed to make sure that the surface or the place that we will be injecting is clean, and so that the bacteria or any microorganism will not go into that part of the injection site. So the rationale in performing or having a clean gloves and using the antiseptic swab is that the pathogens on the skin can be forced into the tissues by the needle. So drying the skin will prevent introducing the ROH into the tissues during injection. So alright ma'am, again after you position your arms, I will be cleaning this with an antiseptic swab, okay? You should apply an antiseptic swab and into a circular motion. Inner and outward. So next is that after the sanitizing or after using the antiseptic swab, next is that remove the cup and hold the syringe between the thumb and the forefinger of your dominant hand with the bevel of the needle pointing. So I will be holding the syringe. And I will be removing the cup. So after removing the cup and holding the syringe, next thing to do is stretches the skin with the non-dominant hand. And the rationale for this is that the taut skin provides an easy entrance into intradermal tissue. After stretching the skin taut at the injection site by pulling gently with the thumb and forefinger at your non-dominant hand, next is that pull the needle very close to the patient's skin. Insert it slowly at the 5 to 15 degree angle until you feel the resistance. So advance the needle up to the epidermis about 1 to 8 inches or 3 millimeters. So slowly inject the medication if you already feel the resistance until you see a blob that resembles a mosquito bite will appear on the patient's skin. So again, I will be putting this needle into 5 to 15 degrees, and then I will slowly inject it until I feel the resemblance. I'm already inserting the medication slowly. So after inserting the medication, next is that we draw the needle at same angle that it was inserted and pat using dry cotton ball. Don't massage and place the syringe back on the tray. So the rationale for this is that it minimizes the tissue's damage and discomfort for the patient, and for massaging the area may interfere with the test results by spreading meds to subcutaneous tissue. So again, I will be applying a cotton ball while I'm withdrawing the syringe. So I will be placing this one back on the tray. So encircle the wheel with a blue or a black pen and instruct the patient or watcher not to rub the wheel or erase the mark. So the red pen may influence the reading. So don't ever use a red pen while encircling the wheel. Cut. Now we'll be so instruct the the watcher or the patient not to rub the wheel or erase the mark. Next. Ayun na. So, next is that the syringe, don't recap the used needle, discard needle and syringe to appropriate receptacle. Wash hands and do not do documentation of nurses' notes. Request the resident to interpret the result 30 minutes after. So the rationale for this is that to prevent needle prick injury, documentation prevents medication error. So I'm applying the cotton ball and I did also encircle the wheel with using the black pen. So next thing to do is that assist the patient to a comfortable position. Indicate at the back of the medicine card, the site, and the due time for reading. So the rationale for this is that nurse consider the well-being of the patient, and writing those data at the back of the ticket will serve a reminder of the nurse on the that the procedure is done. And I will be taking notes or documenting everything that we have done during this assessment. So next, after the intradermal, we'll proceed to the subcutaneous. First thing to do again is that check the doctor's order on the patient's chart. The rationale for this is that the patient's chart is more reliable than a medication ticket. So again, I will be checking or I will be validating the doctor's order. Next, after validating or after checking the doctor's order, explain to the client how she can participate during this assessment, as well as introduce yourself and verify the client's identity. Provide also the opportunity to raise any concern or ask for any clarification. Hi sir, good day. My name is Cassandra Gilomanta and I am your student nurse for today. So today's assessment, sir, is that I will be performing a subcutaneous medication. So I will be administering a medication into your body, sir. So anyway, sir, what's your name again? May I have your name, please?
Sean Christopher Morales.
Thank you so much, sir. Anyway, do you still have any questions, sir, with regards to our assessment?
No.
All right. Thank you so much again, sir, for that. So again, after this, sir, I will be performing the procedure right away. Okay. Thank you. Next, after verifying or after explaining to the client what's this assessment for, proceed on performing the hand washing. So the hand washing is very important. It's because this will reduce the spreading of microorganisms. Next is arrange the medication card into the hypodermic tray with the corresponding drugs. So I have the syringe, the vial, and the cotton bud or the antiseptic swab for this assessment. So after preparing the materials that you needed, next is that discuss the procedure to the client, then explain it to him the side effects or the possible effects on this medication. Next is that determine which site you will use. Shift the patient's bed linen to expose only the potential injection site. After determining or locating the site, next is that palpate the site and avoid any area that is tender. To make sure you have the right size needle, use your thumb and a forefinger to grasp a skin fold of a tissue of the injection site. Then measure the fold from top to bottom and check to ensure that needle is about the half. So after locating the site again and palpating the site, next thing to do is that place the in a comfortable position and ask the client to relax the injection site. Hi again, sir. So for today, can you can you relax this one, sir? Because I will be injecting the medication from this side. Okay. All right. After that one, apply a clean glove and use an antiseptic swab for the injection site. So after clean the site with with an antiseptic swab in a circular motion and starting from inner to apply the gloves. Let's go ahead and use an antiseptic swab to sanitize or to clean the injection site in an inner and outer motion. So let's pretend that this is an antiseptic swab. Again, sir, hi, good day. I will be sanitizing, or I will be cleaning this part of your body because I will be injecting your medication in this part. Okay. So first is that inner part to outer part. So for the rationale for that is that the friction aids in cleaning the skin. A clean area is contaminated when soiled object is shoved over its surface. So that's the rationale why we needed to use an antiseptic swab for us to clean the injection site. And remove the needle cup by pulling it straight off. Hold the syringe between the thumb and the forefinger of your dominant hand as you are holding a dart. So this is my dominant hand, and this will be the position in order for you to remove the cup. Insert the needle quickly and firmly at 45 to 90 degree angle. Release the pinch skin to rest your non-dominant hand on your patient. So this is my dominant hand, and I will be resting this to the injection site. Move your dominant hand at the end of your plunger slowly. Inject the medication over several seconds. Retain your grasp on the syringe to keep it still. Is that after removing the needle cup, insert the needle quickly and firmly at 45 to 90 degrees angle. Release the pinch skin, rest your non-dominant hand on the patient. So after that, I will be inserting the needle quickly. So move your dominant hand at the end of the plunger and slowly inject the medication over several seconds. Retain your grasp on the syringe to keep it still. So quickly withdraw the needle and place a swab or gauze pad on the side of and apply a gentle pressure but don't massage. Top, kasa kung ano ba? Cotton. Aba, ibutang. Spook. Right. Okay, I will withdraw the needle and place it to the hypodermic tray again and put a pressure on the injection site with a cotton ball, but don't ever massage. After administering the medication to the patient, the second to the last thing to do is that position the client in a comfortable position, then document note the procedure that you have on the patient's chart. So, sir, can you sit down? Thank you so much. Are you comfortable already, sir, in your place? Thank you. So I will be documenting the procedure that I did on the patient. So the rationale for this is that we needed to check or avoid the medication error. So that's why we needed to document everything that we have done to the patient. injection or administering the medication to the intramuscular, which is the vastus lateralis of the patient. First thing to do again is to check the doctor's order on the patient's chart. So the rationale for this is that it will the patient's chart is more reliable to the medication ticket. And yeah, I will again check for the doctor's order. Afterwards, explain to the client how he can participate during this assessment. Provide the client the opportunity to raise any concern, clarification, or ask anything. And aside from that, don't forget to introduce yourself and verify the client's identity. Hi sir, good day. My name is Gaston G. Lumanta, your student nurse for today. And for this assessment, sir, I will be administering a medication through your vastus lateralis. And yeah, I will be using a syringe, sir, okay? Alright, again, sir, may I have your full name, please, and as well as your birthday? Alright, thank you so much for that, sir. And anyway, do you still have any questions or clarification before we proceed on the assessment? Alright, thank you so much for your cooperation, sir. So let us go ahead now and do the assessment. After the verification of the client's identity and explaining to the client the procedure that we will be doing today. Don't forget to wash your hands properly, because the rationale for this, it will reduce the spreading of microorganisms. Next is that prepare the materials or the medication card onto the hypodermic tray with the corresponding drugs. So this is my hypodermic tray. I already have the syringe, the vial. Let's just pretend that this is a vial, and a swab, a antiseptic swab. So after preparing all the materials that you needed to this assessment, select or locate an appropriate site for the injection. Either vastus lateralis and deltoid muscles are a possible site for this intramuscular injection. Next is that examine the integrity and the amount of the patient's muscle in a patient. So after selecting an appropriate injection site, next is that examine the integrity and the amount of the patient's muscle mass, and palpate the muscle if there's a tenderness and are not suitable for injection. Then inspect the area if there's an inflammation, bruising, and edema. If the skin shows bruises, inflammation, use other sites. Alright, sir, hello. I will be performing again the medication through your vastus lateralis. Can you this part, sir? And I will be palpating this part, sir. I'll be just inspecting if there's any lesion, edema, or any bruises. Okay. I will be palpating this. As I can see, there's no tenderness on this injection site, and when I try to inspect, or when I inspect the injection or this vastus lateralis or this one, there's no inflammatory bruises or any edema, so it's a good for an injection site. So after palpating and inspecting the part where you will be administering the injection, place the client in a comfortable position so that we'll be able to process, or we'll be able to execute properly the administration of the medication. So anyway, sir, can you lay down for me, please? patient, the client in a comfortable position. Next is that apply a clean gloves and use anatomical landmarks to the side to find the site again to find the site again, and for ventrogluteal injection, place the heel of your hand over the greater trochanter of the patient's hip with the wrist almost perpendicular to the femur. So point the thumb towards the patient's groin and point the index finger at the anterior superior iliac and spine, and extend the middle finger back along the iliac crest forward. So while we use the clean gloves, this is very important so that there will no be or a microorganism that will infect the injection site. So next is that disinfect the injection site or the part where you will going to inject the medication in an inner from inner to outer motion. So I will be using an antiseptic swab to the place to the injection site. So it's inner part to the outer part. So after disinfecting the injection site in a circular pattern from inner to outer part, hold the gauze spot between the third and fourth fingers of your non-dominant. Remove the needle cup by pulling it straight off. Hold the syringe with the thumb and the forefinger of your dominant hand as you are holding a dart. Remove the needle cup, place your ulnar side of the non-dominant hand just below the infection site and pull the patient's skin laterally about 1 to 1.5 inches. Hold the position until you inserted the needle. Aspirate the syringe by pulling back the plunger with your dominant hand. If blood appears, you are not in the muscle. So remove and discard the needle, syringe, and start over. If no blood appears, proceed. So inject the medication slowly at the rate of 1 ml at 10 seconds. Wait 10 seconds and smoothly withdraw the needle. So I will be injecting the medication slowly. And at the rate of 1 ml at 10 seconds. Wait 10 seconds and smoothly withdraw the needle. I will be smoothly withdraw the needle and release the skin and place a gauze pad on the site. Apply gently pressure but don't massage the area. Placing the client into a comfortable position. Last thing to do is that document everything that you have done to this assessment. So I will be documenting the procedure that I've done to the patient. The rationale for this is that it will avoid a medication error. So after that, summarize everything that you have done to the patient as well and explain to the patient that it's already done. Alright, so thank you so much again for your cooperation throughout this assessment. Anyway, my name is Casalonji Lumanta and your student nurse for today. So again, sir, for your medication, I already document everything here, and I will be your own physician, sir, or your physician will be handing to you or will be explaining to you further about the medication that we administer to you. Okay. Alright, so again, sir, thank you so much, sir. I really do appreciate your cooperation throughout this assessment. Thank you so much again, sir, and have a great day. my name is Castellan G. Lumata from BS1 11E, and this is my return demo for parental medication.